Hi, I'm Dr. Karyl Rattay, the Director for Delaware's Division of Public Health. And I want to thank Governor Carney for giving us the opportunity to use his Facebook page to talk about influenza with all of you. So, as you all know, we are in the midst of a particularly intense influenza season. Unfortunately, we're breaking a number of records with flu cases here in Delaware. So, for example, in the week ending February 10th, we had over 1,200 influenza cases in Delaware, which set a record for weekly cases. And we're already getting preliminary information that tells us for the week ending in February 17th, we're going to be seeing at least 1,400 cases, which is putting us over 5,000 cases for the year so far, which again, unfortunately, sets another record that we're not excited about breaking. Tragically, we have seen a number of deaths in Delaware this year. So 19 people have succumbed to this viral infection, and our hearts are broken for their friends and family members. The ages of those individuals are between 44 and 93, and with the exception of one, the rest all had some significant chronic underlying health conditions. And more than 3/4 of these individuals were not vaccinated. So while there's a lot of fear right now around the influenza season, there are things that all of us can do to help improve the outcomes for Delawareans. So first of all, what do you do when you're sick? There's a lot of illnesses out there right now, so how do you know if you have influenza? Influenza shows up pretty classic in that you see a high fever, aches and pains. Headache is very common, and respiratory symptoms are very common. Now, sometimes people can get some vomiting and diarrhea, but it's those other symptoms, the high fever, the aches and pains, and the respiratory symptoms, the sore throat and cough, that are really the most classic. So if you have those symptoms, you or your loved one, what do? Don't just run to the emergency department. Our emergency departments are pretty full right now, and not everyone needs to go to the emergency department. Most importantly, call your primary care provider as soon as you have these symptoms. That's important because there are antiviral medications that, if they're taken in the first 48 hours, can really make a difference for how severe the disease is for you, how long it lasts, and how infectious you are. So first and foremost, if you have these symptoms of flu, call your primary care provider. If you don't have one, go to one of the walk-in clinics that's in all of our communities now. They can help you as well. As things progress, you can talk to your primary care provider along the way, but you got to pay attention to the more severe symptoms. So if you have more severe symptoms, like having trouble breathing, blueness of your skin or under your fingernails, high fever that doesn't go away, persistent vomiting, signs of dehydration or chest pain, those are symptoms that mean you do need to go to the emergency department and get help at that point in time. But for most people, these symptoms can be managed at home. I want to emphasize home here, because if you are sick, one of the most important things that you can and should do is stay at home. Do not go out into the public. Don't go to the supermarket, to the drugstore. Definitely don't go to work. Don't send sick children to work. It's really important that you stay at home for at least 24 hours without a fever, without fever-reducing medications. So that's a really important thing for people to know. Also, when you're at home, try to stay away from the well people in your home. That's how you can help prevent spread within your home. And so for all of us, there are really important things we can do as well. So keeping your hands clean. I know you all hear it all the time, but it is so important right now that every time you see a sink, wash your hands with soap and water. Keep hand sanitizer with you, and keep your hands clean. Keep your hands away from your mouth and your eyes. And also keep commonly touched surfaces clean. So, for example, tables or keyboards or doorknobs. Those are places where germs are easily spread, so keep those clean. That can also do a lot to help decrease the spread of these infections. If you cough or sneeze, do it in your inner elbow. That also can help to decrease the spread of infection. And finally, very importantly, if you have not been vaccinated yet, it is not too late to get your vaccine. There's still plenty of vaccine available at pharmacies, at primary care providers, at public health clinics. If you need to find a location to get your vaccine, go to vaccinefinder.org, and you can find a variety of different locations. Or if you want to learn more about public health clinics, go to flu.delaware.gov, and you can find out where our public health clinics are that you can get your flu vaccine. Now, there has been some discussion about the flu vaccine and it not being as effective this year. It is still the most effective preventive approach that you can take. So even though it's not 100%, it's 36% effective, that still decreases a lot of infections, and it also, very importantly, decreases how severe the infections are and how many people have severe outcomes like hospitalization and death. So again, if you haven't gotten your flu vaccine, go ahead and get it now. And if you need more information around how to find your flu vaccine or any other Delaware information, go to flu.delaware.org. I want to close by saying flu is unpredictable and there's a lot we don't know. So we don't know if we're in the peak of our flu season yet, but we have to expect that we have weeks of influenza still circulating in Delaware. And so if you all do your best at taking these measures that I just mentioned, it's really going to help a lot of people, including you and your friends, family members, and loved ones. Thank you so much.